Welcome to the School for Healthcare Entrepreneurs, the only podcast that provides actionable insights into the healthcare industry. Brought to you by Emitrr, the leading communication platform for your healthcare business.
Hello and welcome everyone to another episode of School for Healthcare Entrepreneurs. I'm Sameeksha, your host, and I have with me today Andrew McCarty, who's an experienced genetic counselor and also the founder for Clover Genetics. Good morning, Andrew. It's great to have you here with us today.
Good morning. It's great to be here as well. Thanks for having me.
Great. So before we start with the questions that we have for you, we would love for our audience to know a little bit about you, what you do, and the experience that you come with, just so that we can set the context for the podcast.
Sure. So I've been a genetic counselor since 2015, and just to give you a little context of what a genetic counselor is, so we're healthcare providers who are licensed and certified, much like any other healthcare provider, and particularly focus on providing counseling around genetic testing, genetics in general, risk assessment. So in a very quick nutshell, that's what a genetic counselor is. And I've been a genetic counselor since 2015. And I've worn a number of different hats. So initially out of graduate school, I worked at the Children's Hospital here locally, and had a couple of different roles involved within inpatient care, as well as utilization management, which I'll probably get into a little bit later. And then I've also worked at a genetic testing lab, a commercial-based lab, really doing everything under the sun there. And then most recently, as of 2020 approximately, had founded Clover Genetics, and have been working on building that ever since. So that's a little bit about me and my various roles and such, and I'm happy to go into a little bit more detail on any of those.
Great. Yes, definitely. And we're so glad. I mean, your experience is what inspired us to have you on the podcast. And, we believe our listeners can also benefit from that. And you mentioned that you've, worn a couple of hats, and recently you decided to, found Clover Genetics. So what led you to, at what stage did you decide that, okay, I've explored enough and I want to start something of my own? So, I mean, when did that start? How was that journey like?
Sure. So that was a little bit of a stepwise process, and I think based a little bit on my previous roles. So the way we set up the practice and the clinic at Clover is very similar to one of the clinics that I helped start at Children's. So one of the challenges with genetics care in general is that there are very few geneticists and very few genetic counselors in relation to the population and compared to other types of physicians or physician extenders, which I would have genetic counselors fall under. So that issue was being seen at the hospital, where there was very large wait times to have individuals seen for basically a concern for a genetic condition or something like that. So we within the Children's Hospital essentially built up a GC only clinic, which is a little bit different than what's typical, where it's usually a geneticist and a genetic counselor seeing patients to provide care. But that's a lot of time and expertise, and it led to 6+ month wait times. So this clinic that we built was a GC only clinic working with referring providers, and really cut down on wait times and improvement of the testing that we ran and all of that. So seeing the improvements and benefits, even just in a health system to utilize a clinic like that, was kind of the first step there. And then as I moved on from that role, working in laboratory as a laboratory genetic counselor, I really saw, there was gaps in terms of education, both at the physician level who are ordering genetic testing, as well as in terms of costs to obtain genetics, and some of the other varied labs have different cost models, and it was basically seeing a lot of issues in terms of access to care and education around genetics. So having both of those big pieces kind of form my experience, and always wanting to really break out on my own, so to speak. I for a really good friend who actually started their own private practice for counseling, and having those types of role models, I thought, I think I could, not to say that I could do it better, but I think there was a need that wasn't being met in terms of access to care, especially in rural areas. So it was an iterative decision, gathering those experiences over time in the last, I suppose, 7 years at this point, deciding to really start the company and see if we could do things a little bit better.
Great. And I believe you mentioned that there's a difference in how genetic counseling is approached as towards other healthcare practices in the healthcare industry, especially in the rural areas. So how did you, sort of identify this gap, and what is it that you're doing at Clover Genetics to build that gap or work towards it?
Sure. So in terms of identifying the gap, it initially came through that experience at the Children's Hospital, of seeing that through various conversations with the senior administration and otherwise, looking at different metrics, noting that there was a very large catchment area for one specific children's hospital, which sees a lot of genetics care. And seeing that there was a lot of volume coming in from 3-4 hours away, which is prohibitive at a certain degree, and that's in Pennsylvania, where it's generally speaking, compared to say the Midwest and other areas in the States, is less rural, but there certainly are rural areas. So doing additional research, working with some of the genetic. There's a state-based NIMAC, New York, Mid-Atlantic consortiums, and they have them all over the U.S. Discussing this. Was able to really dig in and identify that there was a limitation there. So that's really how I kind of came to realize that. And in answering the first part of the question, I forgot the second half.
No, we were just trying. I was saying that, while you did that, like you were trying to identify the gap, what is it that you're doing at Clover Genetics to, sort of help bridge that gap? But I think you somewhere answered that question along with what you just said.
Yes. Yeah, I would say, I think identifying was one thing, and then utilizing telehealth and exploring a lot of the challenges with state licensure and making sure we had appropriate coverage. And really, it's leaning on the technologies of telehealth and the regulatory and making sure to follow the regulatory landscape was the two big pieces there.
I just want to emphasize a little bit more on the telehealth aspect of genetic counseling, and why you thought, and I understand the reach of telehealth is way more than just a physical practice, but how did you leverage telehealth, especially as you mentioned, like 2020 was when you started with Clover Genetics. That was when the pandemic had hit. So how did you navigate all of that together?
So I think the first big thing was, realizing that there's pockets of where genetic counselors are more densely populated than others. So it was identifying that as one piece, as well as the patients, and having them be in two different locations was a challenge. And really from the start, even in my graduate program, I've always focused on technology. One of the big tools for genetic counselors is actually pedigree drawing. So taking a family history and drawing that into a pedigree or family tree. So just seeing the improvements in terms of engagement from individuals using that type of technology, I knew, there's always ways to do things a little bit better. So it was really just a matter of finding, okay, what is the most effective means of providing telehealth, and really just making sure that we had a workflow that properly put everything together and was streamlined for all individuals in terms of, with family history and personal history, it's a lot of intake and such. So we had to be mindful of creating a questionnaire that was conducive to being done on, an electronic form versus going to an office, and making sure that the follow-ups worked at a remote site rather than when someone's in office. So it was really just, putting together all the different pieces to make sure that it created a conducive workflow.
Got it. Just following up on that, and as per my learning, I just wanted to understand that I still believe there is a little gap in the amount of awareness that individuals have about genetic counseling, its benefits. How do you think that is changing now in the healthcare industry? And how do you what do you foresee as the future of genetic counseling?
Oh yeah, that's a great question. I would say, there absolutely in the past has been a lack of awareness toward the value of genetic testing, and that goes along with genetic counselors as well. And I think it's really changed over time. Certainly in terms of cost of testing has come down. Training in terms of different medical trainings and in medical school, genetics has improved somewhat. I think there's still a long way to go there. But that, along with really adoption by not the masses, but everyone who is more aware of genetics in terms of, and I have some hesitations and concerns with direct-to-consumer testing like 23andMe and Ancestry DNA. There are risks to doing that, but it really has created this greater awareness of genetics and the value of it. And I think, along with just, again, improved efficiency and cost for testing, has helped that along the way. And I think those are some of the big pieces there that have really pushed things forward. And I do see that continuing over time as there's further education, and we just continue to learn more in terms of genetics, and it does have a big impact on care sometimes. So I think it'll just continue to develop as we move forward.
Great. I mean, that was really helpful. I also noticed that there's a little bit about where you tend to teach a few other genetic counselors. How do you think, why did you start that initiative of, helping other genetic counselors learn more about genetic counseling, genetic testing, and how is that turning out?
Sure. So I think one of the big challenges with genetic counseling is there's not enough genetic counselors, and it takes genetic counselors to train more, but they're also overworked because there's too many patients to see. So there's this unfortunate vicious cycle there a little bit, which is improving, and there's projections, I think, in the next 10 years they'll actually get to a level that's consistent with demand as it is presently. But I think one of the things I've always been passionate about, and I've recognized even from my first two prior roles to this, is that there is a gap in knowledge for genetics. And one of the things that has always just truly brought me joy is educating others and providing a means of learning more about genetics. And I've truly really enjoyed working with students, be they those in graduate school to be a genetic counselor, even prior to that. So we have a mentorship program as well. So really, it's just been something I've always integrated into every role I've had in some way. So it was natural to continue to do that. There's a lot of individuals, regardless of age or where they are in their career, that have just so many wonderful ideas, or in terms of providing education to individuals or providers, and just have so much value to share. That giving them a platform just felt like a very important thing to do, both to grow Clover Genetics, but also grow them as professionals and improve advocacy in terms of different areas of healthcare and such.
Yeah, I mean, that was really helpful. I understand the entire idea of not just being there as practitioner, as somebody who practices genetic counseling, but also sharing that knowledge and educating those that are upcoming in the field. That was really helpful. I'm sure I have learned enough about what the importance and scope of genetic counseling looks like in the future. But shifting focus a little bit, I wanted to understand your journey, the shift from a healthcare professional to that of now being a founder and running your own practice. And I believe it requires some level of transition from a scientist to somebody who's a business owner now. And since that is also a goal of our podcast, would you like to tell us a little bit about what that journey looked like, and how you could effectively transition or incorporate both those roles that you are doing currently?
Yeah, absolutely. So it certainly was challenging of a transition, and took quite some time. As genetic counselors, training programs already struggle to include the necessary genetics along with the psychosocial skills necessary for a well-rounded professional without the business aspects. It was certainly a learn on the job task for the most part. And just creating the structure for marketing, workflows, HR, and really how to properly advocate and negotiate for business contracts was a big learning curve as well. But the things that really helped me was really experience in my previous roles. So working at a large healthcare system in a hybrid role, both working in the clinic as well as in utilization management. And what utilization management is basically reviewing of, in this case, genetic testing to make sure that it's the most appropriate for the patient at the best time. And it looks at things like cost and diagnostic rates, as well as working with the local insurers, and administrative staff. So through those experiences, I really learned a lot about the healthcare industry at large, and how that can impact the individual patient, as well as the business aspects as well of reimbursements and credentialing and all of that. And I also found, working at the genetic testing lab that I worked for, I was involved a lot with the business development and management of creating workflows and such. So, having those types of experiences, I think, are really important. Certainly, you can just without any experience start a business, but there'll be a steeper learning curve of not having those experiences and not knowing the things that may trip you up, or so I think that was fairly important. And then really just having role models and mentors has been invaluable, just to have someone to say, no, you're doing things right, or from my experience, this is what I did, just to give you kind of a compass of where to go next, or if you run into challenges. And then certainly before I put anything in terms of a website together, otherwise, just a lot of reading and videos of different books of how to start a healthcare business and just business in general. So those were the things that I would say helped me the most.
Great. You mentioned you were referring to certain books and videos and websites. Would you like to share with the audience what some of those were, just so that they can go back and refer to them or learn from them?
Gosh, to be perfectly honest, I'm trying. It was a little while now. I'm looking over at my bookshelf now if I have any of them, and my recall is not good with book titles. So, it started as a quick Google search of what are the best ones to start a healthcare business. But none are sticking out to me right now. Apologies there.
That's okay. That's okay. We can share with the listeners later. So a little bit about, I understand that your journey, you were working with the Children's Care Hospital and then moving to a founder. I just wanted to understand from you how, how do you think technology played, and you did move to a telehealth counseling service. So how do you think, not just in genetic counseling, but how do you think technology overall is working in the industry, and how is that adding value to the entire healthcare sector?
Sure. So I would say, the big things that I think impact the entire sector is access to care. So there's now numerous telehealth platforms available, both for genetic counselors and more broadly, that allows expertise that may not be physically present in one area, to provide impact in areas that, again, don't have that expertise. I've certainly read things in terms of, distant consults, but beyond that, or even surgeons, with different robotic technologies, providing surgical services over great distances. And I think it just, again, provides the high quality and benefits of this type of care that are typically relegated to major metropolitan areas to a much broader area. And I think that just, again, improves healthcare in general for individuals. And I think in terms of the the business side, it certainly spurs along competition and improvements in terms of the cost and diagnostics. And I think in terms of specific to genetics, telehealth has really provided a platform and a greater ability for individuals who want to get into a specific area of medicine, if that's genetics or otherwise, the ability to do so and be less limited by their location and other things. So it improves access to the field as well, I would say. Certainly there's still requirements for training and to be physically present, but I think it diversifies the field as well in some aspects.
Definitely. I mean, I believe like now with growing technology, patient care has become more approachable and it has improved drastically. And if we look at technology on the other aspect, which is the administrative aspect of things, where you're managing marketing, HR, different teams, compliances, how do you think technology has seeped in there? And, how is that helping? Has it been of any help to you? Are you using something particularly to ease all those processes?
Yes. So I would say it's both created and solved problems there. So one of the challenges with genetic counseling, as with many healthcare providers, is licensure is at the state level, but not every state actually has licensure laws on the books. So because we have the ability to see anyone anywhere, we have to be very mindful of ensuring that we have licensure in the state that the genetic counselor is in, as well as where the patient's located. And some of the technologies we have allowed us to, create a workflow of the patient selects where they're located and such, so that that's, basically an automated process. But, it's having 50 states and keeping up on those. There's actually a business that popped up specific for genetic counselors to keep track of all their licensures and all of that, and certainly that's already existed for physicians prior, but this is a fairly new company for genetic counselors, and I think that was really cool to see there. And they're again leveraging a specific software that they created to do so. So I think those are just some of the growing pains as technology allows us to see patients everywhere, so to speak, wherever there's an internet connection. That laws and the regulatory landscape needs to catch up at the federal level in the U.S. For instance. Genetic counselors actually aren't recognized as healthcare providers, so we can't bill through Medicare and otherwise. So there's some lack of access in terms of insurance and payment. That's a challenge that's again being pushed for, but at this point is lagging behind a little bit in terms of the technology, which I suppose seems to always be the case.
No, I mean, I'm sure things will catch up. And what do you think is, if you look at like the problem that you just told me about not having enough regulatory level barriers, how do you envision technology? I mean, if I ask you if we have a software, that can ease all that process, how would you envision something like that to be? And how could, that just ease out all this process of accessing, having access to patients and counselors across the states?
Oh, so that's a great question. So I think there's already some technologies there, but they're lacking. So there's these, for instance, the National Society of Genetic Counselors holds a registry would be the word I would use, that lists all the different genetic counselors, their specialties, where they're located. But then it's really up to the patient to then reach out directly to those providers and then see if they're able to be seen. So if there was a truly integrated process where you had every single genetic counselor could say, okay, this is what I need, and it went right into a automated service where it emails out, says, okay, here's here's what we provide, here's the information that we need to see you. I think for some folks that could help ease some of the barriers of making that first contact, which can be very stress inducing. Certainly other folks want that in person or a person on the phone and providing that as well. But I think that having that aspect will improve things. And then in terms of genetic testing, on the technology side, there's certainly been discussions of doing one and done in terms of a very broad test like whole genome sequencing, and then accessing that over time, over the lifetime, to specifically pull out specific information as it's needed. Obviously there's ethical as well as just pragmatic challenges with holding all of that data and appropriately securing it and otherwise. But I do see certainly some companies have discussed or are trying to use that type of model. But there's been a lot of cutbacks in the industry side of genetic testing recently. And I think tech overall, we've kind of seen this recently. But I think over time, as that industry matures, we may see more of that as the cost of the technology goes down.
Okay, I mean, I sort of understand what you're getting to. It's a community that is easily approachable and has all these compliances and regulatory biases sorted out, is I think you're talking about.
Yes, essentially.
Okay. Just a little bit, I wanted to understand about Clover Genetics, and I'm sure our readers can benefit from this. Those in the genetic counseling field and otherwise also in the healthcare industry, is that acquiring patients is a constant challenge for not just big practices, but also especially for smaller practices like yours. And we work with about 1,000+ healthcare practices, and therefore we know it's a constant challenge for them to acquire patients and to retain patients that they have. And I believe with you, as the awareness is growing, things would be getting better because people are becoming more informed. But how are you still tackling these challenges, and what is it that you're doing so that you're growing your business constantly?
Sure. So yeah, I would say retaining and even identifying referring providers has, and I think will be a challenge. We're 3, almost 4 years old at this point, but building those relationships with referring healthcare providers, typically physicians, is a slow process because you have to build that trust, and there's always a barrier to get between the front staff and the physicians. So we have focused on, and that's actually a big goal for this year, is to focus on those types of relationships at a greater level. But we've also worked on including ourselves in all the different types of healthcare provider registries out there, so that we're able to be located by patients directly or physicians as well. So the NSGC has a website called findageneticcounselor.com. So we have a great majority of our self-referrals come from there, as well as we have some wonderful folks on the team, a few of the interns that work on our social media and provide different means of small fun facts and information about genetics that can help identify where needs may be and just improving that. So I would say again, I think the organic challenge over time is, again, building that referral network, which just takes time in building that trust. But the other area that we have focused on, but has been a bit more of a challenge, is contracting directly with labs or other foundations. But when contracting with another company or group, there's always challenges in how they want something done, which may not work with our workflows, and so it's almost, and at times, more than a year process to go from first meeting to having that. So, I think over time, as awareness improves, both physician referrals and self referrals will continue to increase, but it takes time for sure.
Definitely. I mean, all the best to you and your practice. And I'm sure, with knowledge is power, and with that growing, things will change and shape up in the field of genetic counseling as well. I do not want to take much of your time, so we'll just try and wrap this up. But it has been great having you. And our listeners would love to, reach you. And what's the best way that they could? Because I believe that, we have listeners who are also willing to say, either venture in genetic counseling or start their own business or set up their own practice. So what's the best way to reach you?
Sure. So I would say probably email is best. And that's just my name, Andrew.McCarty, McCarty, at clovergenetics.com. You can also go to our website, clovergenetics.com, and there's my face is on there in other locations as well, or we have a direct website form. So any of those, and you mentioned you want to speak with me, I'll happily find the time.
Any piece of advice that you would have for somebody who's just starting out, setting up their own practice? What you think, out of your learning, your experience, what is that advice that you would give to them?
I would say, really just make some connections with folks who have gone through it, even if it's something peripheral. Having a good mentor or someone to go to that you trust is truly invaluable. You can learn everything that you want to learn, but just having that support, I think, really makes the process a lot smoother. Definitely.
I mean, having mentors is what helps shape us into who we are. Great. It was great having you, Andrew. We would love if you could recommend someone our listeners could benefit from, and we could host them on the podcast to keep this an evergreen process.
Sure, absolutely. And I think, kind of on that same theme of mentors, a good friend and mentor of mine, Jessica Shad, she is an owner and operator of the Counseling Initiative, which is also a private practice that focuses on mental health counseling. And I've really drawn a lot of experience from them, and they have a wonderful organization over there. So I think if they were interested, I think they'd be very great to have on.
Great. Definitely. We will reach out to her, and hopefully we can bring her for our audience soon.
Wonderful.
Thank you, Andrew. It was great having you.
Thanks for listening to another episode of Emitrr's podcast. Want to learn how you can reduce your new patient missed calls and grow your practice by 40% today? Take a look at Emitrr.com.